Discussing stress test is heart-centered cardiologist Dr. Anthony Messina. Dr. Messina, what is a stress test?
A stress test is a non-invasive way to assess the health of a patient's heart. It gives us much useful information in regards to overall heart function and also blood flow to the heart muscle.
What is the purpose of a stress test?
A stress test is a non-invasive way to assess for coronary artery disease or blockages in coronary arteries. Patients are referred to us with numerous symptoms, including chest pain, shortness of breath, or decreased exercise capacity. A stress test will allow us to assess if there are blockages that impede blood flow and oxygen supply to the heart muscle. Although a stress test is a non-invasive test, it is a low-risk test to our patients, and it allows us to better serve our patients.
Are there different types of stress tests?
There are four main types of stress tests. An exercise treadmill stress test allows us to assess a patient's physical capabilities and also to diagnose coronary artery disease. During this test, patients walk on a treadmill, and with time, the pace and incline of the treadmill is increased. An EKG tracing is performed throughout the stress test, and this allows us to assess for coronary artery disease. In certain patients, we would use an exercise nuclear stress test. This is a stress test in which the addition of a nuclear medicine or radioactive isotope is used. The addition of a nuclear medicine allows us to be more sensitive and assess for coronary disease. As with an exercise treadmill stress test, a nuclear exercise stress test is done when patients exercise on a treadmill. And an EKG is also performed during the exercise nuclear stress test. In patients that cannot exercise on a treadmill, a pharmacologic or chemical stress test is advised. During these stress tests, a chemical which is short-acting is given via an IV. The chemical simulates exercise and allows us to also assess for coronary artery disease. The fourth and final type of stress test is a stress echocardiogram. During this stress test, an ultrasound or echocardiogram is performed in order to aid us in determining for coronary artery disease. In certain patient populations, a stress echocardiogram is a test of choice. Because ultrasound technology or echo technology is used, there's no need or exposure to nuclear medicine or a radioactive isotope.
If I have a normal stress test, does that mean that I have nothing to worry about?
Although a normal stress test reveals that there is no evidence of significant coronary artery disease and places you at low risk for future cardiac events, it does not mean that there is no evidence of coronary atherosclerosis. In fact, in order to address this question, further imaging modalities need to be addressed. For example, a cardiac CAT scan or cardiac CTA would be the test of choice in order to assess for coronary atherosclerosis. These tests require the use of CAT scan technology in order to assess and answer this question.